The health department once again logged an all-time high COVID-19 cases today. Total infections have now breached the 693,000 mark, with the highest single daily jump of 8,773. Active cases also inched closer to 100,000 at 99,800. The DOH says 56 more COVID-19 patients died overnight, pushing the death toll to 13,095. Recoveries, meanwhile, are now at around 580,000, with 574 new survivors today. Zooming into Metro Manila, the OCTA Research Group earlier reported that the reproduction rate of COVID-19 in the region has slightly decreased from 2.07 on March 22 down to 1.91 as of March 24. OCTA notes, however, that it is too early to tell if this is now the start of a downward trend. The research group also reports a spike in cases in two areas outside the NCR Plus bubble. They are now calling for close monitoring of COVID-19 infections in Pampanga and Batangas. As for the vaccines, of the 4 COVID-19 vaccines with an emergency use authorization in the Philippines, only Pfizer and AstraZeneca currently have data on the efficacy of their shots against COVID-19 variants. The country's vaccine experts panel says the shot developed by Pfizer provides antibodies, although slightly less effective against new variants. It still protects people, while the AstraZeneca jab provides 75 to 84% efficacy against the B117 or UK variant, and only 10% effective against the B1351 or South African variant. Despite the low efficacy rate, Dr. Nina Glorianti of the Vaccine Experts Panel believes that it may still be used in the country.
The study was only conducted on around 2,000 people, and they're actually trying to study more. Even if medyo mababa yung binding, it's still there rather than zero.
Other vaccine makers with initial information on efficacy against variants are Moderna, Johnson & Johnson, and Novavax. Gloriani says the figures show how COVID-19 variants affect the efficacy of vaccines. The panel is now asking Bharat Biotech with pending EUA application to provide such data.
That is one of the information that we need, yung kung meron silang ginawa about the studies about the effect of their vaccines on the variants. So hinihingi po namin yun, not that it is required.
As variants continue to spread, Gloriani warns about the need for a third dose. Vaccine expert Dr. Lulu Bravo says the increasing cases must be addressed.
That variants are there, it is inevitable. And it cannot be controlled unless you control the transmission of the disease that you are preventing.
For News 5, Greg Gregorio, we are One News.